So what can we do about that? Well, we can't change our parents. My kids would like to occasionally, particularly after Saturday night in here up on the dance floor, but anyway. But for people who are members of a family who have a known germline mutation, they can undergo more vigorous and early screening. So they can do something about picking up a potential cancer earlier. But for most of us, the essence of minimising the risk of cancer is to minimise our exposure to carcinogens, which is what the whole mob are called, and adopt a lifestyle which is known to be associated with a lower risk of cancer. And the public health officials sum it up in the acronym SNAPS, which stands for smoking, nutrition, alcohol, physical activity and safe sex. So in terms of what can we all do to lessen the risk of GI cancer, we can eat more healthily, eat more fruit and vegetables, we can exercise more, and we can reduce our intake of alcohol, fast food and cigarettes. It's not rocket science. It's estimated that 30% of cancers could be preventable through a healthier lifestyle. 3 in 5 Australian adults are overweight or obese, and 90% of us aren't eating enough fruit and vegetables. So there's a lot of scope at a population level for reducing our risk of getting cancer. Moving on to prevention, to quickly talk about screening. Clearly, if we can detect cancers, or even if we can detect polyps, as an example, at an earlier stage, then it's more likely that the treatment will be successful and have a good chance of cure. Good research has developed some screening tests, and the one of most relevance to this presentation is the detection of small, barely, well, you can't see it, invisible traces of blood in the bowel motions. And so because of research, our government has as a community, we've decided that we will offer people routine screening for the detection of early bowel cancers. So we know that some polyps and some early bowel cancers have fragile blood vessels on their surface, and we can lose small microscopic amounts of blood into the stool, which can be detected by these very, very sensitive tests. Sounds a bit gross, and the next slide doesn't require any great explanation. Sounds a bit gross to be fiddling with one's own bowel motions, but it's well worth the effort. And many people in our community have had bowel cancers or precancerous lesions detected at a much earlier stage.